So the Capital Medical Society is the professional association for physicians in the four-county area of Leon, Gadsden, Wakulla, and Jefferson. And it has a long, proud history. And like most associations, it focuses on education, engagement, and advocacy. And so that is a dues-based organization, and we have membership meetings, family day events, all kinds of activities over the course of the year. Now, 50 years ago, the physicians got together and decided to create a nonprofit charitable foundation, what we now know of as the Capital Medical Society Foundation, Inc. We're celebrating our 50th anniversary this year in 2025. And the mission is to support the charitable efforts of physicians and others to increase access to health care, promote education, and serve the community's health needs through innovative projects that are exemplary, affordable, and dignified. And Diana can share more about that, but that's sort of the 30,000-foot view. I know we'll dive deeper into it as to CMS and the CMS Foundation.
So under the foundation, 32, almost 33 years ago, in 1992, the physicians that were working in the foundation and the medical society decided to come up with organized medicine for charitable giving. And so they created the We Care Network program in 1992. And so that is a group of volunteer physicians that donate specialty medical and dental care. Dental was later added in the early 2000s. But it started out as donated specialty medical care for the uninsured residents of the same four-county regions. So we follow Leon, Gadsden, Jefferson, and Wakulla. And so those are going to be for very low-income residents who need medically necessary care and have no other means to receive that care. And so that's what we're here for. And we have a team of 4 case managers who take over those 4 counties and kind of guide the patients through the whole process and try to make it seamless for the providers on both sides. So the referring clinics, primarily we work with Bond and Neighborhood in Tallahassee, but we also have referring partners in the 3 rural counties as well. And so those case managers really help just make everything go smoothly and help everyone navigate the system.
Yeah, I'll jump in first, and then Diana can answer as well. So just this year for the Capital Medical Society, we just installed our 80th president of CMS, so of the Board of Governors. So when I talk about a long, proud history, it's really been there. I mean, it dates back a number of years, and society has changed. Obviously, we're talking virtually, right? When you look at how CMS came up, people were meeting in the same rooms, they would see each other, they would interact and engage more frequently. Now, that's not the way we all choose to engage. So I think when you look at our membership, it's over 600, and it's been over 600 for several years. But the model has changed where physicians aren't necessarily making rounds in hospitals anymore because there's hospitalists. So they don't cross paths with each other as much as they used to through the course of their day-to-day work. So what I see, and serving on the board, we have a good cross-section of different specialties. And these physicians don't necessarily know each other, but they get to know each other. And now in their day-to-day work, when they have a question about whatever it is, whether it's cardiology or it's orthopedics, they know somebody and they have a relationship with them, so they can reach out and they can contact them. So I think that's a real practical advantage or reason, that the people like to network and get together. Diana sees a great crossover and synergy among the physicians who volunteer their time for We Care Network, and I'll let her elaborate on that.
Yeah, and I think it's very similar to when Tom was mentioning, they all know someone that can help you with what you need. And so for us, it's really important to have both sides, from referring partners and donating providers. And so to make sure that they're all educated on what resources are available to be able to identify those resources for their patients on the primary care end is how we get our referrals in the first place. So without their help, we would have a lot harder time identifying the patients in need of our services. So primary care does a really good job of identifying someone that would be a good fit for the program to go through. And then on the donating side, it's really valuable to have the good relationships between not only the medical community physicians, but we have a really good community here from medical and dental. And so there's not a lot of that in a lot of other places. There are many other We Cares around the state of Florida that operate a little bit differently, and they may not have dental, they may not even have a partnership with the hospital, and we are partnered with both TMH and HCA. So we're very fortunate here that we have a lot of support, and we have, some of the medical physicians will identify this patient also needs dental, and they can refer them for dental, and they can go through the program for both. And so I think that's really important to kind of understand how it's all connected and how they're related. Your medical health and your dental health are related in a lot of ways. And so it's really important that they identify that and look a little bit beyond, just what maybe they do, and see what else is out there that can help this patient. And I think our community does a really good job at that, because we're here just for healthcare, but it's never just healthcare that they need. So it's really good to have, this networking too with UPHS, to be able to identify, here's other places that can help you with food or housing or something else that you need that it's outside the scope of what we do, but it's directly relative to your state of health. So yeah, it's a great community because of that. Yeah, so the We Care Network has definitely grown over the last 3 decades and expanded and kind of changed with, navigating the changing landscape of healthcare, and what does that look like not only in our country but in our state. More state specific, we look at the fact that Florida doesn't have expanded Medicaid, and so that is a state-run program, and so it's completely up to the state, whereas Medicare is federally run and federally funded. And so Florida is one of about 10 left that don't have expanded Medicaid, and so that creates a greater gap in access to care. And so within that gap is where we come into play, and we try to narrow that. We can't help everybody, but we can help several people that fall in that gap. And so we get about 2,000 patients referred to us every year, and on average, the volunteer healthcare providers put back into the community about $5.5 million worth of donated healthcare. And so for me, seeing the numbers is tangible. Okay, that's a big impact. That's over $5 million that's going back to these individuals who would otherwise have no means to receive the services. And so in the local healthcare system, what that does is that keeps them out of the emergency department, because you have a lot of people that go there to try to be able to utilize it as a primary care system, because if you're uninsured, and you may not realize there are other places you can go, and you know that you're not going to be turned away at the ER, but you don't need to be at the ER. So that's one of our biggest goals there, is to reduce unnecessary emergency department usage and hospitalizations, and try to prevent that from happening, and kind of step in and help them with what they need, and then to be able to refer them back to primary care afterward, to make sure that the care that they received is sustainable and it doesn't become cyclical, where they fall off the medication or fall off the follow-ups, and they have someone that they can check in with regularly at primary care and make sure that their treatment is still, successful and effective, and that they're still able to get their medications and make their appointments and everything like that. So that's kind of our role, is to just try to come in and at least make a dent in the community there.
Well, certainly they can reach out to the Capital Medical Society or to me directly at tblock@capmed.org, or just talk to a fellow physician in their practice or at their hospital, and I guarantee you that somebody there will be a member and can get them in touch. In terms of the benefits, beyond the networking that we spoke of before, and I really think that's maybe the greatest value, even though there's not a price tag associated with it, if you will. There's huge benefits there. Another thing that's available for members that we haven't mentioned is there's a physician wellness program to address burnout, which obviously, and fatigue, which is very common among physicians. And so any physician anonymously can get 6 well visits a year, if you will, or mental coaching sessions to help them with whatever they may be battling. So that's one of the benefits. We produce a bi-monthly magazine, Cap Scan, that goes to member, as well as a digital e-newsletter that goes out weekly, that really is sort of insider physician news, if you will, and specific to the medical community. So there's great value there. There's events. We do CME and membership meetings. Now, CME is continuing medical education, and nowadays doctors can get CME credits, which they need to renew their license. They can get them through a myriad of ways. through the FMA or on YouTube or through their specialty society. But what I see as the real benefit is that if you're attending a CME, if you attend it online, it might be a physician that's in Dallas or in California, and they're an expert, but they're not somebody that you know or are going to interact with on a day-to-day basis. Whereas the CME programming we provide is from physicians right here in the Tallahassee community in our 4-county area. So you really get a feel for where Tallahassee is in terms of addressing whatever the ailment may be. There's numerous other benefits beyond, I mentioned the family day, beyond the events. From an advocacy standpoint, we have a delegation that goes to the FMA annual meeting every year. And it's really an interesting process, but the FMA will set their legislative agenda at this meeting. And so they have different caucuses of physicians from around the state that meet and literally go item by item on proposed things that people want to, proposed resolutions, things that people want to see turn into law. And they have I would say they can get heated, but I would say they're much more civil, and they're informed discussions about whether this is a good idea or a bad idea. And then that idea advances or doesn't advance on the FMA agenda for the next year. So that's a way to plug in. Our doctors do have an advantage since the Capitol is right here. They're able to get down there and testify or appear before the House or Senate more frequently than physicians from around the state. There's a discount on CE Broker, which is a tool that they use to check and see how they're progressing towards renewing their license. That's another benefit they can receive through membership with CMS. So it's a myriad of things, but the biggest thing I would say is it's the fraternity for local physicians, and the networking to me is invaluable. Well, as I mentioned, this is our 50th anniversary, and so we have big plans. Our signature event every year is a holiday auction that's been long-standing. That's the first Thursday in December, and so we have fundraising goals to raise more dollars than we ever have before, leveraging the 50-year anniversary. I want to add just one layer of context that we haven't talked about related to the CMS Foundation. So the We Care Network obviously does tremendous work, and Diana mentioned $5.5 million last year and annually of donated services. Well, since inception, that figure cumulatively is at $135 million and counting. So thank you to all the providers for the time and services that they donate. I mean, that is not an insignificant number. And that increases access to healthcare. But another real priority of the foundation and the physicians is to fund scholarships for students who are going to, and this is one of the criteria, if you will, who are apt to, after residency, come back and set up practice here in Tallahassee or the Big Bend or the Panhandle. And so FSU has the med school here in the community, and so each year the foundation awards somewhere between $50,000 and $75,000 in scholarships to a handful of med school students. And that's a big number, but we'd love to see it be even bigger. A student may receive $5,000 or $7,000 or $8,000 from the foundation, which is great, but med school costs $200,000 by the time you get through it. And so I think growing that is a real goal, and there's tangible benefit to everybody in this community if those physicians later decide, you know what, I do want to go back to Tallahassee or to Quincy or to Monticello, and that's where I want to set up my practice ultimately. And that is a real, it kind of galvanizes the physicians, particularly those who are from here or made that same decision to set up and practice here. So that's a real priority for them as well.
For the We Care Network, some of our goals and expansions that we're hoping to achieve in the coming years, we've already been working on. I mentioned earlier that, we've changed a lot over the years. We've expanded our services. Tom mentioned previously that there's about 600 members in the medical society, and so about half of those are providing care in our program, and that's because they're going to be the specialist. So all the family medicine and internal medicine primary care can refer, but unless they're of a different medical specialty, they would be a donating provider. And then we have about 40 dentists as well in the community that provide specialty dental care, like dentures and crowns and things that are more intensive treatment than routine cleanings and x-rays. So our goal is to always, be recruiting and trying to fill some of those specialties that we don't have. A lot of that is going to be from provider to provider and trying to help the community understand the importance of the work that they do, giving back through this program. And then also for us, paying attention to what's going on in healthcare policy-wise and seeing how can we address some more gaps. And so one of the biggest things last year was the passing of the Live Healthy bill, and that expanded the financial threshold from 200% of the federal poverty level to 300% of the federal poverty level for volunteer healthcare provider programs. So that's through the Florida Department of Health. And the Florida Department of Health provides sovereign immunity to our donating physicians and dentists, and they also give us the financial eligibility guidelines. And so seeing that, we talked about it with our advisory committee and proposed to the board, which passed our program increasing from 150%, which it had always operated at for 32 years, to 200% in the last summer of 2024. And so we're watching that and seeing how that goes, and then hopefully, staggering and increasing over the next few years, potentially up to 300% is the goal one day, to be able to better serve people that the state identifies would be eligible for these services. In addition to looking at what it means to be uninsured versus what it means to be underinsured when you're really treated as uninsured, and trying to really get into the details of that and how we can serve people who maybe they have one part of Medicare but not another part of Medicare, and that's the part that's needed to get the services you need, and trying to identify how we can navigate that with being respectful of our providers donating their time and respectful of their commitments to the program. So it's a delicate balance. We want to help as many people as we can, but we can't do that without our donating providers. So we have to make sure that we take care of both. So we're kind of the middleman there, but those are some of our goals. Just looking to make a greater impact in the community with how healthcare is going in our 4 counties, but also our state. So